If you and your partner are trying to become pregnant, erectile dysfunction can be a major hindrance. While this is probably all very familiar from 7th grade health class, let's go over some basics on how pregnancy works. In order to start the process of producing a baby, there first needs to be conception. This is when the sperm and egg are united to form an embryo. This conception usually happens in the fallopian tubes that are next to the ovaries. After conception, this embryo will travel down the uterus where it will stay for 40 weeks as it grows to produce a baby. In order for this to happen, there must be vaginal intercourse. During vaginal intercourse, at climax, your ejaculate will contain semen that will have all your sperm. When you're stiff, your penis can penetrate deep into the vagina, giving the sperm the best chance to reach the egg in the fallopian tube and allow for conception. If you do not have an erect penis, vaginal intercourse can be nearly impossible. Without that, getting your partner pregnant is very difficult. However, erectile dysfunction is just one of the many causes of infertility. Having intercourse does not guarantee that a man can make his partner pregnant. Let's back up and define what infertility is. If you have had frequent sex for 12 months without the use of contraception, and you or your partner are under the age of 35, or for just 6 months if you are over the age of 35, you are considered at risk for infertility. 80 to 90% of couples will conceive within 12 months of attempting pregnancy. The general consensus from our experts is that infertility evaluation should be done if you have had difficulty conceiving a baby after 12 months. If you have erectile dysfunction but have been able to have vaginal intercourse but still are not able to conceive, the erectile dysfunction is not the reason for the infertility. For example, if you have been able to use sildenafil with success and are having regular sex to try and conceive, do not blame the erectile dysfunction, and you should consider a proper workup. This will likely include a semen analysis for the quantity, quality, and motility of sperm. The oral PDE5 inhibitor medications used for the treatment of ED do not cause infertility. It is not unusual for men to experience some performance anxiety during the multiple attempts to conceive and therefore experience some ED. This can be a stressful time to conceptualize the timing of ovulation and the most likely time to conceive and therefore have intercourse. If this occurs with regularity, please discuss with your physician as well, because it is possible to improve this type of ED. Getting tested for infertility is a joint effort. Both you and your partner need to have testing done to see where the problem is. If indeed there is a male issue, it usually involves creation of sperm and having a low sperm count. This is the problem in anywhere from 65 to 80% of the time. Other, less common problems are hormonal imbalance or transport problem with the sperm. Going to a clinic and having your semen tested can give you plenty of information. Your partner's workup will be a little more extensive. There is a hormonal and physical examination component, since the female needs to both produce the egg and have a viable place for the fetus to grow. Our experts recommend that both you and your partner should get tested at the same time and work with fertility clinicians to evaluate the best option for your situation. The main takeaway is erectile dysfunction does not cause infertility. If you have successfully been able to have erections and vaginal intercourse, you and your partner should consider getting a full workup if you have not been able to conceive following multiple attempts.